big difference.
During September, Dr. about the auto ship.
Snyder, right before the break, we were getting special. With your purchase of a case of organic noni juice, regular or concentrate, you're going to get a copy of the book free. So don't miss this one. This one is a great one today. Dr. Snyder, right before the break, we were getting into probiotics and the role of probiotics in liver health and liver disease.
So again, and this is, we talked about hepatic encephalopathy, which means when a person has advanced liver disease, they can have buildup of ammonia. And adding a probiotic, I think, to that, especially if it's refractory or the other two medications aren't working as well, I think there's enough, research to show it can be a benefit. But even to prevent liver disease, or if someone has chronic liver disease, the probiotic is a great de-stressor of the liver. I mean, it just does a lot. And liver disease does a couple things to your bowel flora. Liver decreases the motility in terms of your bowel moving. So like we talk about diabetes causing gastroparesis. Liver disease can cause a kind of gastroparesis too. But also when you have liver disease, it changes your bowel flora. So, we have the good bowel flora, like things like bifidobacterium and lactobacillus. Liver disease affects that, and it increases the risk of other types of immune inflammatory conditions, but also that increases the severity of the liver disease. So I do think that normalizing your bowel flora with a probiotic in terms of getting is very important. It also decreases the workload of the liver, especially when you have chronic liver disease. So I think it does multiple things.
Yeah, it's a tremendous addition for liver disease. Now, before we talk about dietary supplements and herbal remedies for liver conditions, I think we should tell the public, remind them, especially in advanced liver disease, you have to be extremely careful with your diet, with your supplements. You must work closely with your doctor, and I think everyone understands that. But a reminder is always good, isn't it?
They need to know, especially because the liver processes everything, and especially we talked about how medications can interact and supplements. I mean, your doctor should know what you're taking. And if there's a question, asking your doctor, asking your pharmacist, you want to keep those people in a loop in terms of what you're doing.
Let's talk a little bit about the classic liver remedy, milk thistle. Everyone wants to use it for detox. Is that a good idea?
That milk thistle has a lot of protective effects for the liver. You had mentioned in your introduction about how milk thistle, about how the liver, in terms of oxygen reactive species and oxygen radicals, milk thistle protects the liver from the development of that. It also may have an effect if there's a toxin affecting the liver, about binding the toxin and prevent it from affecting the liver. So especially in terms of oxidative stress and reducing the stress on the liver, plus its antioxidant properties, raising antioxidant levels, milk thistle is tremendous.
A lot of people have used it for thousands of years with good success. Is there a point where milk thistle is not a good idea? That's possible, isn't it?
If it is, I haven't come across it. Okay. I do think, though, that there's more than milk thistle. I think,
What else?
What else? I want to talk about vitamin D for a section.
Do.
If you look at, and can't really establish a causal relationship, but more of an inverse proportionality. The people who had lower vitamin D levels had an increased risk of developing liver disease. And it's not surprising. So supplementing liver and certain medicines which can affect the liver, like certain anti-seizure medications, can actually lower vitamin D levels. So if you're on that needs to be. So I think increasing your vitamin D, because again, vitamin D does many things, I think can have a beneficial effect on the liver.
The liver, isn't it involved in activating vitamin D? So it's in that process. So in ailing liver, you could have compromised vitamin D status.
Absolutely. And that has to be supplemented as well.
Yeah.
And that's very common in cirrhosis, that they'll have she'll have all their low vitamin levels, like certain B vitamins, like thiamine and vitamin. So a good B complex vitamin, I think, is necessary for optimizing liver health as well. Magnesium. If a person, especially, they may not be, taking in, eating well. If they're drinking, their magnesium levels are low, and magnesium is needed, so supplementing that. In terms of other herbs, turmeric. I like turmeric for a lot of reasons.
Yes.
Turmeric has antioxidant, it protects against oxidative stress. It has effects against fibrosis or scarring of the liver. It also, from an intestinal point of view, which I thought was very interesting, we talked about how the liver can affect the intestine and intestinal integrity in terms of like a leaky gut. Turmeric can actually help with that. It helps with intestinal health. I like alpha-lipoic acid because alpha-lipoic acid helps the cells in the liver communicate better. And if a person has metabolic syndrome and they have insulin resistance, alpha lipoic acid can decrease the insulin resistance. And it's also a potent antioxidant because one of the big things that we're going to talk about a detox plan, we need to increase glutathione levels.
Right.
Alpha lipoic acid helps to increase glutathione levels as well as vitamin C, which is an antioxidant. And N-acetylcysteine. Do you know that liver doctors will actually give N-acetylcysteine? A person's getting a transplant, they'll give it intravenously in the hospital.
Oh.
I've seen even other GI doctors who will give intravenous N-acetylcysteine for people with acute hepatitis.
Yes.
And the issue is N-acetylcysteine, how does it work? It replenishes glutathione.
And we can take that orally.
You can, but you have to make sure that you do it in a form that gets to the cell.
I see.
So it has to be bound to something like cysteine or another amino
Quickly
acid.
before the break, what
Absolutely.
about the B vitamins? I know in alcoholism, which
Yes.
can lead to cirrhosis, these unfortunate folks are often very depleted in their B vitamins.
B1 thiamine, right?
Yes.
Wernicke syndrome, which is due to
Oh, it's
alcohol.
terrible to
So
see.
they need a
Unbelievable.
good B complex vitamin and a thiamine. They also need folate, B6, B12. I think a good B complex vitamin should be part of that package.
Folks, this book, What You Must Know About Liver Disease, has everything we've talked about today and much more. It is an excellent place to start if your doctor says, I'm afraid you have a liver condition. You can learn so much. You know, our doctors are so busy today. You understand, you're in clinical practice. It's one patient to the next. And we must learn more about our health conditions and become more involved. And if you have a liver condition, folks, this is where you start. We'll be right back for a wrap-up.